This is what I presented in AO, Academy of Osseointegration in year 2012. This is me, just before the presentation, nervously waiting. The title of the presentation was 2.5 mm diameter mini implant with dual connection mechanisms for abutment connection. This was the last presentation on the mini implant that I was involved to create back in Korea. Dental implants are highly successful and predictable treatment. However, conventional dental implants require minimum of 7 mm space, diameter of the implant, plus 1.5 mm of minimum distance on mesial and distal side. In everyday practice, we encounter patients who presented with a limited edentulous space that's not possible to treat with the conventional size implant. In these cases, mini implants diameter smaller than conventional implant can be a viable treatment. Mini implants are usually diameter of 3 mm or less. Because of small diameter, most mini implants are one piece, unibody design that prosthetic part of the implant is not separable from the fixture. Because of this, clinicians often face prosthetic constraints. We introduced this mini implant that utilizes separate abutments in various sizes and various lengths in year 2007 AO annual meeting in San Antonio. We have been using this mini implant for several years and collected data, particularly in mandibular anterior area that had been immediately provisionalized. We have collected data in 30 patients with 43 of this mini implant for a study. We have followed a minimum of 1 year after delivering definitive restoration. We found that no implant had been lost. Furthermore, no abutment has come loose. Soft and hard tissues around this mini implant were stable. This retrospective study was accepted in 2009 and published in 2013. These are 2 of the 30 cases that had been immediately provisionalized and followed for 1 year in the study. Some of them were more than 5 years old at the time of the presentation, and they were showing promising results. Abutment connection to this mini implant had been proven secure in many studies. As you can see in this picture, connection maintained by only friction was strong enough to withstand the force that deformed this mini implant made out of titanium alloys. In first version, mallet was the only way to connect the abutment. By tapping the instrument with the mallet, abutment is wedged in. Using a mallet to connect the abutment to an implant had some inconsistency. Level of friction connection was varied by how hard it was hit and what direction. It was also varied by the weight of the mallet as well as how many times the mallet was used. This is a laboratory test showing that weight of the mallet and how many times the mallet is used were the varying factor for the connection strength. Heavier the mallet used, and the more times the mallet is used to engage the abutment, stronger connection was made. I was in the search for a new way of connecting the abutment without use of a mallet, and this is a design that I came up with. If you look at the current design, upper portion is made to hold and drive the implant into the bone, while the lower portion is engaging with abutment. By modifying the upper portion, placing helical screw grooves, friction connection by the mallet is maintained. Abutment can also be screwed to engage the friction connection. Thus, dual methods for abutment connections are possible. Hex driver is to use to hand tighten the abutment initially. Then the torque drive is used to connect the abutment with control without variables as found in the first version. However, mallet can also be used to connect the abutment as before. This is a preliminary test on the new screw mechanism connection. We have tightened the abutment at 20 and 25 Newton centimeter torque each and measured the removing force. They were 19 and 23 Newton centimeter. We had tightened the abutment to 25 Newton centimeter and loaded assembly 100 Newtons of force for 1 million times at 30-degree angle. And we measured the removing torque, and it was 22 Newton centimeter. When we look at the integrity of the screw mechanism after 1 million cycles of loads, we found no deformation. Let me show you 3 clinical cases using this mini implant connection. This is the lower anterior incisor that had a poor prognosis and tooth was extracted. 2.5 millimeter by 13 millimeter mini implants was placed immediately after the tooth extraction. Abutment was selected and tightened to the desired torque for the friction connection. Abutment was adjusted intraorally and immediate provisional was placed for 3 months. Then definitive crown was delivered. For this case, 2 lower central incisors that had advanced period problem were extracted, and 2.5 millimeter diameter mini implants were immediately placed in the extraction sockets with bone graft. Healing was allowed for 2 months, then fixture level impression was taken. For the demonstration purpose, the abutment connection for implant at 24 position was made with screw type, and implant at 25 was made with a mallet type for provisional. Then definitive crowns were delivered about a month later. This is the last case where deciduous canine was lost at tooth 11 position and planned for the mini implant treatment. Because of anatomical concavity, minor fenestration was unavoidable after placing 2.5 millimeter by 10 millimeter mini implant. Fenestration defect was grafted and healed for 3 months. Fixture level impression was taken, and mallet type abutment was modified for provisional in laboratory. Jig was used to transfer the abutment position, and mallet was used for abutment connection. Then the provisional crown was placed. 3 months later, definitive crown was delivered. We have placed about 20 of dual connection mechanism mini implants. Thus far, no implant have been failed. More importantly, no abutment loosening has occurred. We are cautiously optimistic about this connection mechanism. When this 2.5 by 10 millimeter mini implant was immediately loaded for temporary use, we could verify that osseointegration has occurred. The bone to implant contact at the time was 55.8%. For conclusion, this dual connection mechanism mini implant can be connected by either mallet or torque driver. Abutment connection has proven to be reliable. Because of various abutments are available, prosthetic construction is more versatile than unibody design one-piece mini implant. Thank you for listening.